I will start from Abetifi, where the chiefs and people in the area in the Kwahu East District have appealed to government to resume construction works on the Abetifi District Hospital, which has suffered 9 years of abandonment. Abetifi Hine Achemfo Esiedu Ajuman is optimistic the project would be completed by the current administration, but says his people are frustrated after enduring years of neglect by the previous government. In this special feature, our humanitarian of our health desk, who has been on the stalled hospital projects, reports the people of Abetifi, who released prime land for the project, are disappointed with the delays.
John Dramani Mahama-led administration in 2015 began the construction of 10 key district hospitals across the country with funding support from the UK government. They included Dodowa in the Greater Accra region, Fomena and Kumawu in the Ashanti region, Garu Timpali in the Upper East region, and the Abetifi District Hospital in the Eastern region. All 5 projects, designed, constructed and equipped by NMS Infrastructure Limited, have been completed and operationalized, but the Abetifi District Hospital, which can be expanded to 200 beds, has suffered 8 years of neglect. When completed, the facility will be the first ever government-initiated and completed health facility in the Kwahu and Afram Plains areas of the Eastern region, since all major health facilities are all CHARC affiliated. They are the Kalik Hospital at Ngoko, Kwahu Hospital built by the Seventh-day Adventist Church at Etibie, and the Presby Hospital at Donkokrum. Situated on 40 acres of land, the Abetifi facility is not only a pale shadow of itself, as it has been left in ruins at the mercy of the weather. While walls have tripled and fallen over each other, portions of the staff bungalows have had their roofs ripped off. The level of deterioration you see around here represents several years of neglect, at least 9 years of abandonment by government. Abetifi Hine, a Chamfo Esiedu Ajuman, used the just-ended Kwahu Business Forum to appeal to President Mahama to revisit the hospital project.
Now, Oshasia SOBC Hospital be at the Amayan, Ewo Abetifi. Madama, we do baby, but then I'm self of Yantrapa and we got your Bamono. This is Abri, baby, our year, Udija Hono.
In a series of street protests, residents have been up in arms against traditional authorities for giving out prime farmlands for the project at the expense of people's livelihoods.
I felt so bad because if you are a leader and the people you are leading feel bad about something and accuse you of making a wrong move, it puts you in a bad shape, very bad situation. It was quite a chunk of land, and the two of us just couldn't have gone there to sell the land, even without the knowledge of our superior chief. So I felt so bad. Later, I think everything died down. And how the work was going on, I mean, we all felt good that now, apart from aside all our accusations, something good is coming. And so when it came to a standstill again, we felt so bad.
Abetifi Hine, a Chamfo Esiedu Ajuman, tells Joy News the people of Abetifi are frustrated because they have nothing to show after 9 years of waiting.
About 9 years ago, the government conceived an idea of building a district hospital from the people of Kwahu, precisely Kwahu East District Hospital. The idea was mooted by the then President John Dramani Mahama. At the end of 2016, after election, the government in power lost the election and a new government was formed. We were thinking after the formation of the new government, or when the new government came into place, he may continue with the project of building the Kwahu East District Hospital. In the first budget of President Akufo-Addo, he mentioned it and has made reference to it that the project will continue. I think after 1 year, there was nothing in the budget that showed that he had any idea of continuing with the project. The situation we see now there after 9 years have made us regret for giving out the land. Not because we've given the land out and have regretted later, but the situation in which the facility stands now is what has made us regret for what actually has happened.
But despite the setbacks, the chief is optimistic President Mahama will continue the project.
We still have every confidence that the government will come and put up the structure for us. I feel confident in the first place because he started it. There were only 6 or 7 of them, and out of so many districts in Ghana.
Well, President John Mahama says his government will intensify efforts for the implementation of an indigenization policy aimed at renegotiating mining leases to ensure greater local participation and benefit for citizens from the country's natural resources. Speaking at the Ministerial Executive Leadership Program in Ada, he emphasized that while foreign mining companies will not be forced out, it is critical that mining directly benefits the communities where operations take place. He lamented the underdevelopment in many mining communities despite decades of resource extraction. The diamond mine operated by Goldfields recently faced the threat of closure after the government initially withheld the renewal of its lease. However, the government has since confirmed it has reached an amicable agreement on transitional arrangements for the mine. Both the government and the mining company have committed to working together in good faith to ensure a smooth 1-year transition towards Ghanaian control and sustainable operation.
We had colonial masters, we had no say, and so they mined the gold, they took it away, they developed the palm plantations, took the palm oil away, they took the diamonds away, took everything away. And when we gained independence, Nkrumah warned us and said colonialism might have been defeated, but we're entering the era of neo-colonialism. They don't need to bring a governor to sit here, but they still would, from wherever the colonial headquarters is, control your resources and be able to still derive the benefits as if they had colonized you. And that exactly is happening. Post-colonialism, we didn't have technology, we didn't have capital, we didn't have the human resource. And so foreign companies come and take huge concessions and they sign it off for a pittance. And they run those, concessions to the benefit of the colonial metropolis. Today, I think that in Africa, we've developed the core of human resource that is capable of also taking advantage of some of these resources. We've developed the technology, we have the technology to be able to do whatever any of these big conglomerates are doing. And the capital is available in the world to mobilize, to be able to do the same things. And that is why recently we had a little issue which we have resolved with one of our mining companies whose lease had expired after 30 years, and it was our desire to take it over and use Ghanaian expertise to be able to also exploit that resource and let the benefits remain in our country. Happily, we reached an amicable resolution to work together to transition that mine into Ghanaian ownership. But it leads me to what my thoughts are, that we must have an indigenization program for taking control of some of our natural resources. And so in the next few months, we'll develop a policy on indigenous participation in our natural resource exploitation. And anytime, we're not going to expropriate anybody's concession or anything. But anytime a lease comes up for renewal, we would want to negotiate to see that there's more Ghanaian participation, indigenous Ghanaian participation in these.
The Ghana Medical Association is urging the Minister of Health to abandon what it described as theatrics and focus on the urgent challenges crippling public health care delivery across the country. The association's message follows doctors at the Tamale teaching hospital's decision to suspend emergency and outpatient services indefinitely. The industrial action follows what the doctors have described as the Minister of Health's demeaning and unacceptable treatment of one of their colleagues during recent official engagement. We'll go to the Tamale Teaching Hospital shortly, but the Ghana Medical Association is backing the decision. Here's General Secretary Dr. Richard Salome in an interview with my colleague Elton Bobi.
Clearly, the minister either has chosen not to read or is being very, very disingenuous. The statement we have issued is clear and straight to the point. Probably you need to read it to his hearing, if maybe he hasn't read it. We specifically condemned how the dismissal went, even though we acknowledge the fact that the minister has the power to hire and fire. Right. We just felt that we haven't seen any letter. We heard it in the media. They were reported that it was because of the negligence. He is now claiming that it was already in process, administrative issue to reset the hospital. Fine, that is so. But if you read our statement, you will know that that was not it. Nobody does inquests on camera. It has issues of patients' confidentiality. Patients' details will come out. Probably even some family members don't know. It has risks for public confidence in healthcare. And it also has serious implications. Now that the doctor is being threatened, he is the MP, is he there to protect the doctor? Social media has been sent messages saying that he's killed the patient. People are on his page cyberbullying him. People are sending messages to the wife and his family. And the MP is there saying that it's because they've questioned him. Who says nobody can question the doctor?
Well, let me take you live now to the Northern Regional Capital, Tamale, for the very latest on this, and Martina Bugri joins us on the line. Martina, how is the suspension of emergency cases affecting patients in need of medical care?
Still seated at the emergency unit waiting for, I should say the OPD, waiting to be attended to. Some who knew or already have plans have gone to various hospitals.
Looks like there's a problem with
to try their luck somewhere, but in here hoping that some magic would happen. But right now, as we speak, the Parliamentary Select Committee on Health held a meeting with the management a while ago. They are currently actually in a meeting with the doctors as well, and we are told that right after that meeting, they are going to meet the entire staff of the TTH at the conference. So as we speak now, the Parliamentary Select Committee is right here at the hospital. Now, when you move around the hospital, people are worried that if something is not done immediately to stop the strike from going further, lots of people would suffer in the few days that they'll be off.
Well, Martina, when we spoke to you on News Desk, we saw quite a number of patients waiting to be looked after. Are they still there, or the numbers have decreased since then?
Some have left, but we still have more people sitting, and people are still even coming in, because most people are not aware. The information hasn't gone out yet that much, and so people keep trooping in, but they come in and they are told that for today they are not working. Now, the interesting thing is that the nurses do not really tell the patients that the doctors are not coming. They take care of them and direct them to go and wait. So if you don't have any idea about it, you probably will be sitting there for a long time unless somebody tells you that they are actually not working.
But how would you describe the general mood, now that the Parliamentary Select Committee is meeting with the health authorities there? Has it, lessened the tensions earlier reported?
I must say that tensions would not go down. Earlier, we were told that we could not film the facility, and they even threatened to seize journalists' gadgets who are here and they are filming or want to talk to patients. So that's how tense the situation is. You are not even allowed to move freely to do your work in a public space like the hospital.
Right. Thank you so much, Martina Bugri, who is at the Tamale Teaching Hospital. Well, this afternoon, the health minister appealed to doctors at the hospital to call off their strike, but refrained from apologizing to them as demanded.
The health sector of this country has experienced decline for the past 8 years. And for that matter, I acknowledge that the health professionals have worked under challenging circumstances. I'm the first person to appreciate that. And we are committed as part of the reset agenda in righting the wrongs. But I know that it will not be easy. I need the cooperation of everybody, especially the health professionals. I cannot do all this alone. Without the cooperation of the medical doctors, the nurses, the pharmacists, much cannot be achieved. Irrespective of the challenges, what I want to appeal to all the facilities in this country, that let us ensure the optimum utilization of the limited resources available to us. And that includes the management of the base. With the greatest degree of respect, let us not get to a point where the ordinary Ghanaian will feel that because he doesn't know anybody top there, the poor Ghanaian, the helpless one, when something happens to him or her, nobody will come to his rescue. That will be a disaster for all of us. In my humble opinion, every life in this country matters. And so I have come with an open mind, with new energy, and with your cooperation. I know we are going to achieve a lot together. I can understand. The system has been like this for a very long time. And so coming up with a new strategy, with new leadership, may be a bit difficult. But I can assure you, we must all have the ordinary Ghanaian in mind. That at the end of the day, we are all serving the people of this country. Let it not be said that due to the scarce resources we have at our various health facilities, the poor man, the helpless Ghanaian's life has been sacrificed. My doors are widely opened. I'm not a perfect human being, but I listen. And I'm prepared to work with everybody in the sector. I said, let's all come together and work together for the betterment of the health sector. It can happen to everybody. It happened to me when I had an accident. The first place I was rushed to was Nyahini District Hospital. I never imagined that I would one day be at Nyahini District Hospital, but I was there. And so today, sitting at where I sit, I will contribute my quota to the development of this sector. I have absolutely no intention to disrespect any medical doctor or any health worker.
Well, my colleague Collins Frimpong joins us live from the ministry. Collins, is the presentation done?
Right. The Minister of Health, Kwabena Minta Kando, is done with the presentation, and he did it with that of the Director General of the Ghana Health Service, Professor Samuel Kaba Akuria, and also the new CEO for the Tamale Teaching Hospital was also present, who received the materials on behalf of the hospital. That is Dr. Abubakar Bawa Abdullahi, who is the senior official at the University of Development Studies, UDS, and he's the new Chief Executive for the Tamale Teaching Hospital. He was here to receive the equipment on behalf of the hospital. Some of the materials that the minister handed over to the hospital included, or they are 35 different materials, and among them, some of the important things include the things that the doctors at the Tamale Teaching Hospital are demanding for, including some basic consumables, and some of these equipments include, let me start with the basic consumables, including the gloves, the face masks, and also the assorted sachets. These are some of the basic consumables that the health minister has handed over to the Tamale Teaching Hospital. Other important materials that he also handed over included 3 Draga ICU ventilators, 6 Draga ICU cardiac monitors, and also Draga transport ventilator, as well as 5 oxygen concentrators. So these, as behind me, you can see some of the equipment that they've already packed them into the truck that they are ready to transport them to Tamale. So these are some of the equipment here that he has handed over to the new Chief Executive of Tamale Teaching Hospital this morning at the Ministry of Health.
Well, the Foreign Affairs Minister Samuel Okudzeto-Ablakwa has outlined what he describes as a 5-point plan to transform Ghana's passport application regime. In the next 4 days, the Foreign Minister says Ghana's passport regime will now be switched to a chip-embedded one. The move marks the first step to broaden reforms targeted at improving service delivery. There's more in the following report.
Of moves to improve service delivery for passport applicants while safeguarding the integrity of Ghana's travel document, Foreign Affairs Minister Samuel Okudzeto-Ablakwa says his outfit is ready to roll out a chip-embedded passport regime.
This modernization effort is designed to enhance broader security, reduce identity fraud, and streamline international travel for Ghanaians. As we roll out our cutting-edge chip-embedded passport, we seize this opportunity to categorically state that the era of middlemen and unofficial agents operating within our passport offices is unequivocally over. We strongly advise all citizens to directly interact with our official channels and adhere to established procedures when applying for or renewing their passports.
The modernization plan comes amidst growing concerns about the activities of middlemen and other challenges that have crippled attempts at making passport service delivery seamless in Ghana. But the minister says that will no longer be the case.
Ladies and gentlemen, for the avoidance of doubt, our resetting Ghana passport reforms can be itemized as follows. And I'm doing the summary for the media. There are 5 reforms that we are rolling out on the 28th of April, 2025, which is Monday, the Monday ahead of us. And these are the 5 reforms. 1, we are switching from biometric to chip-embedded passports. 2, we are introducing 24-hour passport operations in line with President Mohammed's 24-hour economy policy. 3, we are introducing passport delivery services through courier to enhance convenience. 4, we are introducing e-tracking services for citizens to effectively monitor the entire passport application and delivery process. And 5, we are reducing passport application fees by 30%. That is from 500 Ghana cedis to 350 Ghana cedis by amending the Fees and Charges Act as soon as Parliament resumes from recess.
The 5-point plan on reforming Ghana's passport regime is expected to take off on April 28 as stakeholders remain hopeful that will bring about the necessary change in Ghana's passport application system. Blaise Ogan's report for Joy News, Accra.
National Communications Officer of the NDC and CEO of the Gold Board, Sammy Gyamfi, has criticized the response of the Chief Justice to allegations which has since been leaked to the media as unsatisfactory, stating that her suspension makes sense because the CJ needs time and focus to mount her defense.
If the president had not suspended her, justice administration could have suffered, in the sense that the Chief Justice, who has administrative oversight over the entire judiciary and, for that matter, the administration of justice, will obviously be busy mounting a defense for herself at or before the committee which has been set up by the president to investigate this matter. And nobody can convince me that she can attach the needed attention that justice administration requires from that high office, the office of Chief Justice. I mean, when we need her to take very critical decisions, it could well be that she may be before this committee defending herself. The administration of justice is so important, and it cannot be entrusted in the hands of a person who is going through, an investigative process under Article 146. She will not have the peace of mind and cannot give adequate attention to her important role as administrative head over the judiciary. And that is why it makes sense that she be asked to step aside for another to act in her stead.
Well, former NPP MP for Sekondi Andrew Ejapamesa says on the basis of the petitions, copies which are now public, there was no basis to make a prima facie determination against the Chief Justice and subsequently suspend her.
So essentially, if the evidence that has been adduced is not disproved, then it is deemed to be true. Right? So the CJ has been asked.
Wait, I want to be sure of the position you are taking. That prima facie means guilty until proven innocent.
So let me read. Prima facie case in law means a claim has sufficient evidence to be considered valid on its face, meaning it's true unless proven otherwise. That's what it means. So I take a step back and I say, having seen the petition and the responses that the Chief Justice has given, and now imagine assertions to the effect that one individual, there's rumor that it is actually the Honorable Justice Sophia Akufu, the former Chief Justice, who abstained. I don't know whether it's true or not. Sammy says he cannot confirm or deny it. And in law, your guess is as good as mine when a response to that effect is given.
Well, away from that, a Nigerian couple based in Wa, Bashiru and Hawa are celebrating the rare birth of naturally conceived quadruplets, Adamu, Hassan, Hussein and Hawa. According to medical staff, this is the first time the Wa Municipal Hospital and the Upper West Region have recorded a natural birth of quadruplets. The couple, who already have 8 children, including 3 single births and a set of twins and triplets, say they are both excited and overwhelmed by the arrival of the new additions. Joy News' Upper West Regional correspondent Rafiq Salam reports that while the birth has brought immense joy to the family, caring for the quadruplets will be a daunting challenge. The couple is appealing for support to help them raise the children.
Before our Bashiru delivered the quadruplets. She already had 8 children with her husband, Basiru Adamu, 3 single deliveries, 1 set of twins, and a set of triplets. The highly fertile Nigerian woman, who is of Zabarama extraction and based in Wa, weighs 84 kilos and a height of 5 feet 9.7 inches. Her husband, Bashir, migrated to Wa from Niger some 18 years ago in search of a better life.
We are told by doctors that it is extremely rare to have natural conceived quadruplets, but it happened in this hospital, the first since the establishment of this facility in 1954.
We have a twin gestation in one in 80 beds. Now, for you to have a triplet is 1 in 8 raised to the power 2, the square of that value. Okay. Now, to have a quadruplet is 1 in 80 raised to the power 3.
The couple are proud to be parents to the 3 boys and 1 girl. They are Adamu, Hassan, Hussein, and Hawa.
I have nothing to say than to thank God for giving me the quadruplets.
The delivery of the quadruplets was something decreed by God, which I'm grateful for. I will forever honor and adore him. Hawa was rushed to the maternity ward of the Wa Municipal Hospital late evening of April 15, 2025. An emergency cesarean section was conducted on her at 33 weeks gestation.
Since my practice, bad cases always sneak in at dawn. Always. And that's what happened in this case. She came in, she went into labor, and with the quadruplet, the only means of delivery is always by cesarean section.
Obstetrician gynecologist at the hospital, Dr. Jonathan Suweri, led a team for the cesarean section that also included a medical officer, 1 midwife, 1 nurse anesthetics, 2 scrub nurses, and blood bank personnel. Dr. Jonathan Suweri considered that it was a difficult task, but they came out unscarfed.
So we had an able team available. Our theater team were up and going, and kudos to our blood bank. They were able to get us blood available. The uterus became flabby after delivery. When it was flabby, the woman was bleeding. So after delivery, she was just pouring torrentially. That's it, torrential, a lot of blood. So quickly, we started to say the best option for her at that moment was to do a hysterectomy for her. So we just did a hysterectomy. The blood bank was able on call to supply us the blood. So in all, I think she received 2 units of blood after the case.
Hawa was then moved to the recovery room after the cesarean section and monitored by critical nurses at the recovery room.
We managed her here for like 8 hours. When she was fully recovered, she started SIPS. Then we realized that she was hemodynamically stable and was ready for the ward.
Delivery strategy for Madam Hawa is 1-1-2-1-3-4, which means that she gave first a single child, second a single child, third twin, fourth a single child, fifth triplets, and then also the 6th one that we are celebrating today as quadruplets.
Part of her medical bills was absorbed by the hospital.
I think the hospital, we have been able to do our best. We're able to try and give her some pre-nan, but I'm just calling on all philanthropists, goodwill people, if they have any spare money to spare this woman, anything available. If you have extra clothing that you think you don't need, that you can supply to this woman. If you have any extra coins that you were thinking about using to buy credit or something, just donate it for this woman. She will need every dime counts for this woman.
Hawa headed to Mangu, a suburb in Wa that the family stayed for over a decade. The unassuming mother of 12 thanked God for the gift of life and the honor that need to have the quadruplets. She considered giving birth to quadruplets is exciting, but having and taking care of them is a huge challenge.
Getting food for them to eat will be our biggest challenge.
It is evident in the room that she stays with a dozen of children.
This is the living room of Mr. Basir and his wife. This is where the family of 12 lives. You can see that the place is not all that spacious enough, and then also ventilation in this room is very poor, and that's why they have even opened their windows, and the woman is using a container lid to even fan the children. There is no electricity in this particular room.
When Howard got to the hospital and was told that she would deliver quadruplets, I know I was running into trouble. I had been looking for a way of having an additional room. I bought a truckload of sand, but I couldn't mold the blocks because I don't have money. The area around the house is filthy. They have no potable water in their home. Close relations, especially women who came for the outdooring of the quadruplets, went to a nearby borehole to fetch water for them. One other challenge faced is transportation. They will have to depend and pay for the services of a tricycle any day they are to attend postnatal services at the hospital. A cost too high for the unemployed woman and the bicycle hawker. I offered them a free ride on my case portage on their first review day at the hospital shortly after the naming ceremony. The naming ceremony was attended by family members, business partners, and friends.
Congratulations to the Nigerian couple, and right here on News Today, we'll take a break. When we return, we bring you today's episode of Breaking the Fire Cycle series.
Hi, good afternoon. Welcome to Business. My name is Darryl Kwao. Chief Executive of Petroleum Energy Limited, Michael Bozumbil, is advocating the implementation of a robust zonalization policy that ensures fair balance between the interests of oil marketing companies and the consumer. Speaking to Joy Business, he called for a system that promotes equitable access and pricing across the board without disadvantaging either party.
Fought on the zonalization policy. The chamber is saying it should be scrapped. Boss is saying it should be maintained. What is your thought as a player?
Okay, thank you very much. For us as players, the focus is on product availability and seamless access to petroleum products, because a policy must aim at ensuring that the consumer gets the product at an efficient, cost. So whether there's zonalization or there's no zonalization, I think the key point is how efficient is the system. And from that standpoint, as a player, the current system is very inefficient. So if we want to continue with zonalization, let's make it efficient. Because this is not the first time. This policy has been there, but there have been some, challenges in recent years. So I am not in any way, in this straitjacket approach of saying let's stop zonalization or, or otherwise. Bottom line, there must be seamless, operations. I'll give.
And in other news, MTN Ghana has reaffirmed its commitment to empowering businesses through technology and innovation. Chief Enterprise Business Officer at the company, Angela Mensah-Poku, made this known at the Chief Technology Innovation Officer Roundtable Africa event. Here's more in this report.
The Chief Technology Innovation Officer CTIO Roundtable Africa event brought together thought leaders and industry experts to explore how digital transformation can accelerate business growth and innovation across the African continent, with a specific focus on Ghana. Chief Enterprise Business Officer of MTN Ghana, Angela Mensah-Poku, highlighted MTN Ghana's strategic commitment to integrating digital literacy into everyday business operations.
The great thing about MTN and MTN Business today is we're rolling out capacity building. So we will be doing digital literacy, digital marketing for our SME businesses. So it doesn't matter where you are. wherever you are, we'll hold your hand and we'll teach you small, until you are the experts, until you're telling us what we should be doing. So at every level, we're coming in and we're making sure that we can hold your hand and educate you so that your business grows from bigger to bigger to bigger.
The Chief Information Officer for MTN Ghana, Bernard Akwa, emphasized the pivotal role of data in driving modern business success.
Machine data analytics, AI, of course, machine learning, and really those are the ones to start the journey with. Okay, data analytics is a big one, because if you don't hold data properly, it's like building a house on sand. The foundation of AI is the data you're holding. So anything that involves holding your data and being able to analyze that data, that's the key skill that companies should start with. And they can start small. That's what I was trying to say in my talk. Start small. When you are more confident, then you build up.
The CTIO Roundtable Africa event provided a valuable platform for MTN Ghana to reinforce its vision of building a digitally inclusive economy.
And that's it for business. Sports is up next.